So before I get deeper into what I exactly do at work, I just want to let you know. Welcome back to my channel, Nurse Gigi the Gab Fashionista. And if you're here with me for the very first time, thank you so much for clicking this video. Thank you so much for coming to this channel. And don't forget to hit that subscription button plus that bell so that you are alerted to all my new and wonderful videos that's gonna come out on this channel soon. So thank you so much. You're now part of my Nista family, and all my Nistas out there, all my family, thank you so much for coming back to my channel. And today I have a video where I'm just going to be letting you know a little bit more about what I do at my job. So I get a lot of questions about what exactly is my position at work and what I actually do at my job. So if you have not checked out my day in the life video, when I went to work, what I had to do in service, then please check that out. I will have it in the cards. And yeah, let's get right straight into this video. So yes, I am a nurse, a RN, and my specialty is home care nursing. So all of my nurses out there who are in home care, shout out to you guys. But for me as a nurse, what my role is a DPS. So that basically stands for Director of Patient Services. So in my role is a management position, and what I basically do is just making sure that the services that the patients receive in a home care setting is really good. So before I get into that, let me just let you know the background of the job. So for this position, you have to be a nurse, a RN, and I talk about not really being a bedside nurse. And like I said, there's so many different positions out there that nurses can obtain. So one of them is being a DPS, and I love doing paperwork. So for you to be a case management nurse, or a professor, a teacher, or even home care nursing or insurance nurse, disability nursing, just to name a few, but we all deal with paperwork. So if you do not like paperwork at all, then probably this wouldn't be the position for you, because it's a lot of paperwork we have to do. Most high-tech agencies have already converted everything to using software, but at some agencies, like mine, I still have to use a physical chart, and I still have to chart what I do in a physical chart, and then afterwards I have to do the same thing within the computer software. So maybe in the future, I don't know, we will probably go doing everything by electronic, so that I don't have to like do so much. But as of right now, and I'm basically used to it, because since I entered nursing, I've been doing charting on hand and electronically, so it doesn't really bother me at all. I'm so used to it. Requirements to be a DPS is basically that you have to have about 2 to 5 years worth of registered nurse home care experience. I would see why they need home care service. And maybe the person might have a disability, maybe the person might have a functional disability that they're not able to walk, or they might have a mental disability that maybe they had dementia, that they're not able to function to their highest ability, and that's why they need home care service. So it is my role to see exactly what they will need. And I still do home care visits to see my patients, but for the majority of agencies, a DPS normally would do those visits when it's an emergency, or when there's not a nurse available to do the visit for that agency. The DPS supervises registered nurses or even LPNs to just make sure that they are able to just do their visits and that everything's okay in the home care setting. I go into the home and I will do their vital signs, which will just be doing blood pressure, pulse, respiration, and listening to the heartbeat and listen to the lungs. So I'm able to do that. And if there's a patient that is on oxygen therapy, I would do a pulse oximetry also. Because of the pandemic, I'm just doing my visits over the phone and doing video chat. And it's easy and hard at the same time, I would say, because if you're not used to doing the video chat for your patients, it could be a little bit hard on their end of the stick in regards to technology. But after a while, it gets a little bit easier for them. And the ones who are not able to do video chat, then I'm perfectly able to do it over the phone with them. So as a home care nurse, the main thing is to make sure that the patient is safe in the comfort of their home, and that's the reason why they need home care service, because they have functional limitations, whether it be cognitive, whether it be physical, or any other impairment that will make it hard for them to actually be able to live in their home independently and to do what they have to do in terms of their personal care and in terms of taking care of activities of daily living, such as sweeping, cleaning, grocery shopping, whatever that may be. And that's why they need a home attendant to come into the home. So besides doing visits, what I will also do is I am in charge of teaching home care in-service classes for the home health aides. So I do that on like a quarterly basis, and also I am able to do orientation for new home health aides who are able to start working, whether it be that they're coming into the agency or that they need to become a certified home health aide. So if you don't have your home health aide certificate, you could just come into the office and I will be able to teach you how to be a home health aide. That's not the least of what I do. So now let me get into the paperwork part of it. So now if any patients have a fall, any emergency, I am the go-to person of who should be informed of that, because I want to make sure that that patient is not going to have a fall or not be in that emergency situation the next time. I have to you know, put it down as in my report. I have to do a dual report basically on what happened, and also have interventions set up so that it doesn't happen again in the future. If there's any infections that is, you know, new, like say a patient comes in with a COVID-19 infection, or if there's a UTI, or that patient just have a new diagnosis, then I should be informed of it so that I could put it into my infection control log. So it's like basically a lot of paperwork that goes into it. It's not tedious for me because I like doing the paperwork, but if you're not into the whole paperwork thing, and if you're more of a hands-on person, then it probably would be a tedious factor. But it's really not. Like, I'm not saying it's easy either, but it's something that you get used to as you go along the way. I also run reports to make sure that I'm in compliance with doing my visits. So I have to do that on a monthly basis, run a report and see whose reassessments are due. And it's very easy. I just have to have the computer, the software generated for me, and then I am able to meet that requirement. It's not hard at all. I do the med orders, which will be me sending out a medication order, which is also called a 485 to the doctor, which states what the home care service agency is providing and the names of the medication and the dosage that the patients are on. And basically the doctor reads it, verifies if everything is true, or if there's anything that needs to be added, then he or she would add it into that order. I need the order from the doctor in order to initiate or continue to have a home care service. So that's the gist of the medication order. With that medication order, within my physical chart, I'm able to do medication reconciliation, which means that I'm just going through the list to make sure that everything is updated. Like whatever I put on my list in the chart matches with what's on the medication order. I hope I'm not leaving anything out. I don't really think so, but if I happen to leave anything out, then just let me know I left something out, and I have no problem correcting myself. And if you are interested in becoming a DPS, or be it in the specialty of home care nursing, or if you're in already, then let's have a dialogue down below. Thank you so much for watching this wonderful video.